the FDA actually changed their ruling on testosterone recently. The news came out, right? So they're finally referencing the Traverse trial, and they're removing the black box warning about testosterone. For years, I don't know, maybe in decades, the warning was that testosterone might cause heart attack or stroke, or increased risk for heart attack and stroke, and there's absolutely no evidence to support that.
Yeah, they finally read that study correctly. Unfortunately, in that study, many of the population that was in it already had atherosclerosis or hypertension or some level of diabetes or cardiovascular disease, so they were already at some level of risk. What that study did see that more of those patients and more of those participants actually had better outcomes. That study, the Traverse trial, as well as many other studies that supported that testosterone reduces all-cause mortality in men for things like cardiovascular disease, diabetes, dementia, prostate cancer. So it's really a great drug or great hormone to boost men who are looking to increase energy, who are looking to lose weight, who are looking to sleep better, feel better, have better sexual activity in the home. This is a great, exciting time for hormone replacement therapy and for us here at Balance Beloved to be able to support men with this kind of treatment.
Yeah, whenever guys ask me about TRT or testosterone, I'm like, doesn't it cause heart attack? You know, that's one of the first concerns or questions, right? You know, of course, I have to go through the whole thing explaining, no, it's a warning that they had to put in there because there was some insurance database analysis of, like you said, a bunch of people who already had atherosclerosis,
heart disease, cardiovascular disease, blood pressure. So what we have seen is because testosterone builds muscle in men, it helps them lose visceral fat. Visceral fat is that deep fat in and around the organs, in between the cells, that drives inflammation, and inflammation is what drives disease. Drives diabetes, cardiovascular disease, Alzheimer's. And so when we give testosterone, we've noticed over time, and it doesn't happen in 1 month, but we do notice over time that men will lose weight, they'll increase their muscle mass, thus improving their longevity and their quality of life.
Fitness is like everything, right? It's like people try to think about all these different ways to hack their health and all these different supplements and techniques and cold plunges and everything. Not to say that any of that stuff is bad, but like the very, very basics is just lose fat, gain more muscle, and everything gets better.
Everything gets better. There's definitely several studies we know in rehabilitation that muscle improves quality of life, and this is just one other thing that supports that.
Have you seen any cases of our female clients with benefiting from testosterone? Does anything come to mind?
Absolutely. Many of our women who either struggle with libido or inability to gain muscle completely benefit from testosterone. Or on top of that, when we think about women in menopause or later years of life, testosterone not only improves libido, but because women lose muscle mass by 1 to 3% every year in menopause, it helps them remain strong by maintaining their muscle, which then helps improve bone health and reduces risk for things like osteoporosis or other kind of diseases. On top of that, it reduces the risks for urinary tract infections because it improves vaginal tone and it improves their skin health and collagen synthesis. So there's less risk for things like UTIs or dementia or other related disorders because of that.
Oh, it's interesting. I always work on the men's side of the testosterone side. I think about like UTIs for women.
For women, especially in menopause, it can completely benefit that.
It also just directly builds bone, right? The testosterone.
Yeah, testosterone does as well. It helps build bone because it's improving muscle. And that muscle pulls on the bone and helps the bone repair itself. There's no drug that exists that can actually build bone. But we have learned that things like testosterone, one of the hormones that we prescribe to patients here, actually does help repair the muscle tissue, then repair the bone. We see changes in things like DEXA scans, where they may come in with osteopenia or osteoporosis, and we see reversals within a couple of years after patients have been on hormone replacement, such as testosterone.
Yeah. Well, this is a reversal. This is not like the bisphosphonates. They just try to halt or slow down to break down in bone. And we're talking actually reversing that process and now building bone back, right? Nobody does that.
Exactly. Not to mention, taking a biphosphonate doesn't feel good. It makes the patient feel very sick or makes them achy. And testosterone doesn't do that at all. In fact, it actually makes them feel so much better, improves their quality of life, gives that person confidence, improves things like libido and sex drive, and then the person feels more confident, and they have increased motivation to do the activities they've been wanting to do.
Energy is like the thing.
Yeah, energy is huge.
Yeah, I had a post on social media about testosterone, and someone commented like, "Yeah, it changed my life because it reversed weight depression. It took me out of depression." And he also said ADHD. So he said to solve this depression, ADHD, and he said without that I wouldn't be able to work or do anything with my family life. And someone responded, it was like a hater. It's like, really? You couldn't work or anything because of I'm like, depression. I responded defending this guy. Like, depression is a real thing.
It's very real. We have been consistently treating depression or mood disorders in men and women with SSRIs or other new antidepressants.
Like me being medical
community, and all that is done is altered their brain activity, altered the kind of serotonin, dopamine release responses in their brain, and downregulated those things, or increased an excess amount of serotonin. And what those things have done is we've seen, all of us can talk to medical providers as well as patients, weight gain with taking some of these SSRIs, lower libido, and then just overall feeling kind of flat and not present in life. But because we haven't really considered the fact that someone may be depressed or someone has mood changes related to actually hormone imbalances. And if we balance them out and optimize those things, we actually see really positive changes.
Yeah, but you're actually it's curative, not just like suppressing symptoms or band-aiding
Yes.
symptoms.
We're not looking at band-aids, we're looking at solutions, things that come from already within our body that are exactly, and we're giving something that's exactly the same as what's inside their body. We're not doing any synthetic type of prescribing, and that's what typically we have done in the past. Historically, the medical community has seen these kind of things and said, here's a synthetic version of that. But now we don't have to do that anymore because those synthetic versions is what caused exactly what it was talked about. It's black labels and made everybody scared, but now we are living in a time where we have bioidentical supplements that are exactly the same type as what's in their body, and it helps us just feel better and live a better life.
Well, it takes about a decade or something to clear up. It's hard on weight.
But we can always be excited to them and basically calm everyone and say, hey, this black label is gone, and that is not true. This is not what is going to cause blood clots and strokes and heart attacks. It's definitely not this hormone testosterone.
Yeah. So we'll wait another decade for our next win, but we'll take this one for now.
I'll go lay it for now. Shake it for now.
Yeah.